$90 billion. That's what 4 pharmaceutical companies pocketed in profit in just 2 years from a single global emergency. To put that in perspective, it's more than the entire annual economic output of most countries on Earth. Here's the question almost nobody asks about how that happened. Who actually got rich from the COVID-19 vaccine? Not a question about science, not about safety, not about effectiveness, a question about money and where it came from. The answer runs through billions in public funding, contracts most people never saw, and a small group of companies that turned a global emergency into the most profitable stretch in their history. Meanwhile, on the other side of the world, entire countries waited years for doses that wealthier nations already had in surplus. This is the story of how money decided who profited and who was left waiting in line. To understand how this happened, you have to go back to May 2020. The world was in the middle of an economic shutdown. Hospitals were overwhelmed, and there was no vaccine for a virus that had already killed hundreds of thousands of people. The United States government launched a program with a name that sounded more like a military operation than a health initiative, Operation Warp Speed. Its goal was blunt: produce a working vaccine faster than had ever been done in modern medicine, and do it by removing the one thing that normally slows pharmaceutical development to a crawl: financial risk. Under normal conditions, a new vaccine takes years, sometimes over a decade, to move from early research to a finished product sitting on a pharmacy shelf. Companies test in stages. They wait for one phase to prove safe before funding the next. It's slow because it's expensive and because failure is common. Most vaccine candidates never make it to market at all. That's part of why, before 2020, vaccines were never considered the most profitable corner of the pharmaceutical industry. The margins were thin, the timelines were long, and the financial risk sat entirely on the company placing the bet. Operation Warp Speed rewrote that equation. Instead of waiting for one phase to succeed before funding the next, the government paid companies to run research, clinical trials, and mass manufacturing at the same time, before anyone knew whether the vaccines would even work. By the end of 2020, the government had committed somewhere between $13 and $18 billion to this effort, depending on how you count the funds that were redirected from other public health programs to make it happen. That single decision changed everything about who carried the risk. If a vaccine candidate failed in trials, the government had already paid to manufacture it. If it succeeded, the company kept the exclusive right to sell it and to set the price. 6 companies received the largest share of this early support: Pfizer and its partner BioNTech, Moderna, Johnson & Johnson, AstraZeneca, Novavax, and the pairing of Sanofi and GSK. Pfizer alone signed a deal worth close to $2 billion just to manufacture and deliver once approved. Sanofi and GSK secured over $2 billion as well. Novavax received $1.6 billion, and all of this moved through a system that made the exact terms difficult for the public to see. A large share of Operation Warp Speed's biggest contracts were routed through a private defense contracting intermediary, which meant the underlying agreements were shielded from the kind of public records requests that would normally apply to government spending of this size. But the government's investment was only part of the story. The scientific foundation the vaccines were built on went back much further than 2020. The mRNA technology used by Pfizer, BioNTech, and Moderna, the platform now worth tens of billions of dollars, had been in development for decades, funded in large part by public research money through agencies like the National Institutes of Health. Scientists working on that early research were paid government salaries. The breakthroughs that made mRNA vaccines possible weren't discovered inside a corporate lab chasing a product launch. They came out of years of publicly funded basic science that most people had never heard of and that no company could have replicated on its own timeline. So by the time Operation Warp Speed began writing checks in 2020, the companies involved weren't starting from zero. They were standing on top of decades of public investment and then receiving billions more to eliminate the financial risk of turning that science into a product. What they kept, once the vaccines were approved, was something the public didn't get any share of: the patent, the exclusive legal right to manufacture, price, and sell the only tool the world needed to get out of a global emergency. This is where the story stops being about public health and starts being about economics. A patent doesn't just protect a company's investment, it creates a monopoly. And a monopoly on the one product every government on Earth suddenly needed at the exact moment they needed it most is one of the most powerful financial positions any company could ever find itself in. The question that follows is not whether the vaccines worked, it's what happens financially once a handful of companies hold exclusive control over something the entire world is desperate to buy, and how far that advantage would end up stretching long after the worst of the emergency had passed. By early 2021, the vaccines were approved, and the demand was unlike anything the pharmaceutical industry had ever seen. Nearly every government on the planet needed doses, and they needed them immediately. Under normal market conditions, that kind of demand would trigger competition, new suppliers entering the market to meet the need and drive prices down. But because the vaccines were protected by patents, that competition never happened. There were only a handful of approved products made by a handful of companies, and every country on Earth was bidding for the same limited supply. That created a very specific kind of leverage. Wealthy nations with more money to offer up front secured the largest and earliest orders. The United States, the European Union, the United Kingdom, and Canada signed advance purchase agreements, deals that paid billions of dollars before a single dose had even rolled off a production line in exchange for guaranteed priority access once it did. Some of these countries reserved doses far beyond their own populations needed, effectively locking in supply that other nations with less purchasing power could not compete for. At the other end of that same supply chain sat countries that couldn't offer the same kind of upfront capital. A global initiative called COVAX was set up specifically to try to correct this imbalance, pooling funding from wealthier nations and international donors to buy and distribute doses to lower-income countries that couldn't outbid the largest buyers on their own. It was a reasonable idea on paper. In practice, COVAX depended on the same limited global supply that wealthy nations were already absorbing through their own direct contracts. By the end of 2021, less than 8% of the population across sub-Saharan Africa was fully vaccinated. In some of the hardest-hit countries, when doses did eventually arrive, they came with such short shelf life remaining that health systems were forced to destroy or reroute them before they could even be used. A year later, by December 2022, only around 28% of adults across Africa had been fully vaccinated, compared to vaccination rates well above 70% across most high-income countries during the same period. This is the part of the story that rarely gets connected to the financial side. The same limited supply that created record profits for a handful of companies was the reason entire regions of the world spent years waiting their turn. It wasn't a matter of the vaccine not existing. It was a matter of who could pay for it first and who controlled how much of it existed at any given moment. And the price itself kept moving. Once the initial emergency contracts expired, Pfizer and Moderna both raised the price per dose significantly, reported increases of over 50% for Pfizer and over 70% for Moderna between 2020 and 2022, even as public health officials in several countries pushed back, calling the increases difficult to justify given how much public money had funded the science behind the product in the first place. The companies, for their part, pointed to their own additional private investment. Moderna alone had put over $3 billion of private capital into its mRNA platform before the pandemic and raised another $1.5 billion to scale up manufacturing once the emergency began. Both sides of that argument are real. The government did take on enormous risk, but the companies also walked away holding something the government never got any ownership stake in: the exclusive right to price and profit from the product that risk helped create. By the middle of the pandemic, two very different financial realities were unfolding at the exact same supply chain. In one, a small number of companies were converting public research and public financial guarantees into record-breaking private profit. In the other, entire regions of the world were still waiting for their first dose. The question the rest of this documentary will answer is not just how much money was made, but exactly who made it, how the mechanism worked in practice, and what it reveals about who controls access when the entire planet needs the same thing at the same time. To really understand this story, you have to follow the money through 4 distinct stages: public research funding, risk elimination contracts, patent-protected pricing, and finally, shareholder return. Each stage transfers value from one place to another, and by the time you reach the 4th stage, the money has moved almost entirely in one direction. The first stage is the one most people never hear about because it happened years, sometimes decades, before anyone had heard the word pandemic. The messenger RNA technology at the center of both the Pfizer, BioNTech, and Moderna vaccines wasn't invented in 2020. It came out of research stretching back to the 1990s and 2000s, much of it funded through the National Institutes of Health and other public science budgets. Scientists doing that foundational work were, in many cases, paid government salaries, not corporate ones. This is the part of the mechanism that matters most because it means the starting point of the entire vaccine wasn't private capital taking a bet on an unproven idea. It was public capital, absorbing decades of risk on research that had no guaranteed commercial application at all. The second stage is where Operation Warp Speed enters and where the risk profile flips from long-term and diffuse to short-term and concentrated. Instead of a company spending years testing a vaccine candidate on its own dime, hoping it eventually pays off, the government stepped in and paid for trials, manufacturing, and distribution logistics up front, before final approval, and in some cases before anyone knew whether the vaccine would clear its trials at all. If it failed, the public had still paid for the manufacturing capacity. If it succeeded, the company that developed it walked away with something the public funding didn't buy them any share of: ownership. That's the third stage, and it's the one that turns public investment into private leverage. Once a vaccine is approved, the patent grants its manufacturer the exclusive legal right to produce and sell it. No public funding requirement forces that price to reflect the public's share of the investment. The company sets it based on what the market, meaning governments desperate for doses, is willing to pay. And because there were only a handful of approved vaccines competing for the same global demand, the companies holding those patents had enormous room to set prices well above the cost of manufacturing without losing customers to a cheaper competitor. There simply weren't enough competitors to force the price down. The fourth stage is where the profit finally lands, and it's worth being specific about where it actually goes. It doesn't get redistributed back into public health infrastructure. It doesn't return to the research agencies that funded the underlying science. It flows to the company's shareholders in the form of dividends and stock buybacks, and to executives in the form of compensation tied to the company's stock performance. Pfizer's $11 billion in shareholder payouts in a single year is a useful way to picture the scale of this. That's not money spent building more manufacturing capacity or lowering the price for lower-income countries. It's money returned directly to the people who already owned shares in the company. Now, to be fair to the other side of this argument, not every dollar in that chain came from the public. Moderna is the clearest example. Before the pandemic, the company had already raised close to $4 billion in private investment to build its mRNA platform, money that came from venture capital and private markets, not government grants. When the pandemic hit, Moderna raised over $1 billion more in private capital, specifically to scale up manufacturing. Executives at the company have argued, reasonably, that private investors took real risk backing an unproven technology platform for years before it ever produced a marketable product. That risk deserves a return. The debate isn't whether private investment played a role. It clearly did. The debate is whether the scale of the eventual profit was proportional to the risk that was actually taken on once you account for how much of the underlying science and how much of the manufacturing risk had already been absorbed by public money before private capital ever entered the picture. If this is the kind of financial analysis you want to see more often, subscribe to Capital and Consequence.
There's one more piece of this mechanism worth breaking down clearly, because it explains why the price kept climbing even after the emergency phase ended. During the height of the pandemic, most vaccine doses were purchased directly by governments under advance agreements negotiated during a public health emergency, deals that included political pressure to keep prices reasonable given the circumstances. But once countries shifted from emergency mass vaccination campaigns to routine, ongoing purchasing, treating the vaccine more like an annual product, similar to a flu shot, that political pressure eased. Pfizer and Moderna both moved toward standard commercial pricing, and that's when the reported price increases followed, over 50% for Pfizer, over 70% for Moderna, compared to the emergency phase price per dose. From a purely financial standpoint, that's a predictable move. A company holding patent protection on a product with no direct competitor, facing recurring demand rather than one-time demand, has very little incentive to keep pricing at emergency crisis levels once the emergency framing fades from public conversation. The incentive runs the opposite direction, toward capturing as much of that recurring demand's value as the market, in this case largely governments and insurers, will bear. This is also the exact mechanism that explains the second half of this story, why the same limited global supply that created record profits in wealthy countries also meant slower, thinner access everywhere else. When a small number of patent holders control both the supply and the price of a product every country urgently needs, the countries with the most purchasing power get served first, fastest, and most completely. The ones without that purchasing power are left negotiating for whatever capacity is left over, through mechanisms like COVAX, which, however well-intentioned, was still competing for allocation against buyers who could simply offer more money faster. So the full mechanism looks like this. Decades of public science lower the starting cost of innovation. Billions in public risk elimination funding remove the financial danger of bringing the product to market fast. A patent then converts that publicly de-risked product into an exclusive, privately owned asset. And once that asset exists, ordinary market dynamics, global demand outpacing supply, minimal competition, and a legal monopoly do the rest of the work, pushing profit upward and pushing the weakest buyers to the back of the line. Nothing about this required a conspiracy. It required a set of financial incentives working exactly as financial incentives are designed to work, applied to a product the entire world needed at the same moment. So who specifically sits at the top of this mechanism? 4 companies capture almost the entire story. Pfizer partnered with the German biotech BioNTech, Moderna, and the Chinese manufacturer Sinovac. Between 2021 and 2022 alone, these 4 companies combined for roughly $90 billion in profit tied directly to COVID-19 vaccines and treatments. Pfizer accounted for the largest share at around $35 billion. BioNTech and Moderna each brought in close to $20 billion. Sinovac, whose vaccine was distributed heavily across Asia and Latin America rather than in wealthy Western markets, still generated roughly $15 billion. What makes Pfizer's position particularly striking is that the company didn't take direct research funding from Operation Warp Speed the way most of its competitors did. Its CEO, Albert Bourla, was explicit about the reasoning at the time. Accepting government money for research, he said, always comes with strings. Instead, Pfizer funded its own vaccine development and only accepted government money for manufacturing and guaranteed purchase once the vaccine was already approved. On the surface, that looks like a company taking more risk than its competitors. In practice, it also meant Pfizer avoided the kind of public scrutiny and pricing pressure that came attached to direct research grants, while still benefiting from the same publicly funded mRNA science that made the entire platform possible in the first place, and from the same guaranteed purchase contracts once its product cleared trials. Moderna's story runs almost in parallel, but with one added layer. Before the pandemic, Moderna had never brought a single product to market. It was a research company built entirely around a promising but unproven technology platform. The pandemic changed that overnight. The company's executives, who had spent years failing to convince investors their science would ever produce a commercial product, became some of the wealthiest people in the pharmaceutical industry within about 18 months. Moderna's profit margins on its vaccine peaked above 60%, a figure almost unheard of for a product manufactured at global scale. Then there's BioNTech, the smaller German partner that actually developed the core vaccine technology Pfizer would go on to manufacture and distribute worldwide. Its founders, a husband and wife team of scientists, had spent over a decade researching mRNA-based cancer treatments with limited commercial success before the pandemic gave their underlying platform its first massive real-world proof of concept. Almost overnight, they became among the wealthiest people in their home country, primarily through their equity stake in the company rather than salary. What connects all three companies, Pfizer, Moderna, and BioNTech, is not that they did anything outside the rules. Every dollar of profit traces back to a legal patent, a legal contract, and a legal pricing decision. The advantage they captured wasn't hidden or improper. It was structural. They held the only approved products the entire world needed at the same time, protected by exclusive legal rights at the exact moment global demand had no meaningful alternative to turn to. That structural advantage is the actual mechanism of how the lucro moved from public risk into private hands, and it explains why the same handful of companies, rather than a broader competitive market, ended up capturing nearly the entire windfall. So who, specifically, sits at the top of this mechanism? 4 companies capture almost the entire story. Pfizer, partnered with the German biotech BioNTech, Moderna, and the Chinese manufacturer Sinovac. Between 2021 and 2022 alone, these 4 companies combined for roughly $90 billion in profit tied directly to COVID-19 vaccines and treatments. Pfizer accounted for the largest share at around $35 billion. BioNTech and Moderna each brought in close to $20 billion. Sinovac, whose vaccine was distributed heavily across Asia and Latin America rather than in wealthy Western markets, still generated roughly $15 billion. What makes Pfizer's position particularly striking is that the company didn't take direct research funding from Operation Warp Speed the way most of its competitors did. Its CEO, Albert Bourla, was explicit about the reasoning at the time. Accepting government money for research, he said, always comes with strings. Instead, Pfizer funded its own vaccine development and only accepted government money for manufacturing and guaranteed purchase once the vaccine was already approved. On the surface, that looks like a company taking on more risk than its competitors. In practice, it also meant Pfizer avoided the kind of public scrutiny and pricing pressure that came attached to direct research grants, while still benefiting from the same publicly funded mRNA science that made the entire platform possible in the first place, and from the same guaranteed purchase contracts once its product cleared trials. Moderna's story runs almost in parallel, but with one added layer. Before the pandemic, Moderna had never brought a single product to market. It was a research company built entirely around a promising but unproven technology platform. The pandemic changed that overnight. The company's executives, who had spent years failing to convince investors their science would ever produce a commercial product, became some of the wealthiest people in the pharmaceutical industry within about 18 months. Moderna's profit margins on its vaccine peaked above 60%, a figure almost unheard of for a product manufactured at global scale. Then there's BioNTech, the smaller German partner that actually developed the core vaccine technology Pfizer would go on to manufacture and distribute worldwide. Its founders, a husband and wife team of scientists, had spent over a decade researching mRNA-based cancer treatments with limited commercial success before the pandemic gave their underlying platform its first massive real-world proof of concept. Almost overnight, they became among the wealthiest people in their home country, primarily through their equity stake in the company, rather than salary. What connects all three companies, Pfizer, Moderna, and BioNTech, is not that they did anything outside the rules. Every dollar of profit traces back to a legal patent, a legal contract, and a legal pricing decision. The advantage they captured wasn't hidden or improper. It was structural. They held the only approved products the entire world needed at the same time, protected by exclusive legal rights, at the exact moment global demand had no meaningful alternative to turn to. That structural advantage is the actual mechanism of how the lucro moved from public risk into private hands, and it explains why the same handful of companies, rather than a broader competitive market, ended up capturing nearly the entire windfall. If the last two blocks explained who captured the profit, this one explains who carried the cost. And the cost didn't land in one place. It landed in at least three very different places, each with its own kind of consequence. The first group is the most straightforward. Taxpayers in wealthy countries, particularly the United States and several European nations, who funded the risk elimination stage of this entire mechanism. Billions of dollars went into research, clinical trials, and manufacturing capacity before anyone knew whether the vaccines would even work. When a vaccine candidate failed or underperformed, that public money didn't come back. It simply absorbed the loss, the same way an insurance policy absorbs a claim. That's not necessarily a bad use of public funds during an emergency. Removing financial risk is exactly why the vaccines moved as fast as they did. But it does mean the public paid for the downside without receiving a share of the upside once the successful products started generating tens of billions of private profit. The second group carried a very different kind of cost. National governments and health systems that paid steadily rising prices for a product they had no real alternative to. Once Pfizer and Moderna shifted to standard commercial pricing, health ministries and insurers were left negotiating with sellers who had no meaningful competition. In a normal market, a buyer facing an unreasonable price increase can simply choose a different supplier. In this market, there wasn't one. That's not a moral failure on anyone's part. It's simply what happens financially when a buyer has no leverage against a patent-protected monopoly on something considered essential. The third group is where the human cost of this financial structure becomes most visible, and it's the group that had the least ability to do anything about it. lower and middle-income countries, particularly across sub-Saharan Africa, spent years waiting for meaningful vaccine access, not because the vaccines didn't exist, but because the existing global supply was already being absorbed by wealthier buyers who could pay faster and offer more. By the end of 2021, fewer than 8% of people across sub-Saharan Africa were fully vaccinated. In several of the hardest-hit countries, when doses finally did arrive, some came with such short remaining shelf life that health systems were forced to destroy portions of the shipment rather than administer it in time. This is where it's important to be precise about cause and effect. COVAX, the international initiative created specifically to correct this imbalance, wasn't a failure of intention. It was underfunded and undersupplied because it was competing for allocation against buyers with far more purchasing power inside a market that had no meaningful competition to begin with. When there are only a handful of suppliers and every country on Earth wants the same limited product at the same time, the buyers with the most money reliably get served first. That's not a conspiracy. It's simply what scarcity does inside a monopoly, and it's the direct financial consequence of the same patent-protected pricing structure that generated record profits in wealthier markets.
By December 2022, roughly a full year after high-income countries had already reached vaccination rates above 70%, only about 28% of adults across the African continent had been fully vaccinated. That gap wasn't primarily a matter of local hesitancy or logistics, although both played some role. It was substantially a matter of global supply having already been allocated elsewhere, months and sometimes years earlier, through contracts signed by buyers who could move faster and pay more. It's worth naming clearly what this cost actually was, because waiting longer for a vaccine understates the scale of the consequence. Extended periods without broad vaccine coverage meant extended periods of restricted economic activity, delayed reopening of schools and businesses, and continued strain on health systems already stretched thin by the pandemic itself. Economists studying the broader impact of uneven global vaccine distribution have pointed to significant losses in global economic output tied directly to the slower recovery of undervaccinated regions, losses that extended well beyond the countries left waiting, since disrupted supply chains and delayed trade recovery in one region rippled outward into the economies that depended on it. There's also a quieter cost worth naming: the debate over whether patent protections should have been temporarily waived during the emergency, allowing manufacturers in lower-income countries to produce generic versions of the vaccines locally, rather than waiting for donated or purchased doses to arrive from elsewhere. That proposal was formally discussed at the World Trade Organization and ultimately produced only a limited, narrowly scoped waiver years into the pandemic, well before the period of most severe supply scarcity had already passed. Pharmaceutical companies argued that waiving patent protections would undermine the incentive structure that funds future vaccine research in the first place. Public health advocates argued that a global emergency was exactly the circumstance patent protection was never designed to withstand. Both arguments contain real logic, but the practical result was that the legal structure protecting private profit stayed fully intact throughout the period when global supply was most scarce, and the countries with the least purchasing power paid the price for that scarcity in the currency that mattered most during a global emergency: time they didn't have to spare. The next part of this story is about what all of that money and all of that control actually bought the companies that ended up holding it, not just in profit, but in lasting influence. Money on this scale doesn't just sit on a balance sheet. It converts into something more durable: influence over the next crisis and the next decade of public health policy gets shaped. That's the part of this story that outlasts the pandemic itself. And it isn't theoretical. There's already a concrete example on the table. In July 2024, the U.S. government, through BARDA, awarded Moderna $176 million to develop a bird flu vaccine using the same mRNA platform, later expanded to $590 million to accelerate development and prepare for other emerging flu strains. The company that received billions in emergency contracts in 2020 was, 4 years later, the government's default partner again, not because of a new competitive bid, but because of the track record and infrastructure built during the emergency. That's not a hypothetical about influence. That's the mechanism repeating in real time. Start with regulatory relationships more broadly. Before 2020, Pfizer, Moderna, and BioNTech had a certain standing with health regulators and government purchasers, but nothing close to what they have now. Having successfully delivered the product every government on Earth urgently needed, these companies became the default partners for the next generation of health emergencies. When a government needs to move quickly on a future health threat, it now turns first to the companies with proven manufacturing capacity, an existing regulatory track record, and an existing relationship built during the pandemic. That's not a formal advantage written into any law, it's a practical one, and in procurement, practical advantages compound. Then there's the platform itself. Before the pandemic, mRNA technology was a promising but commercially unproven idea. Now it's a validated, globally trusted manufacturing platform with a direct pipeline into government purchasing systems. Moderna and BioNTech have both used that validated platform to pursue an entirely new generation of products, cancer treatments, flu vaccines, and other infectious disease targets, with a credibility and a fundraising position that would have been unthinkable for either company in 2019. That leverage extends into national industrial policy as well. Countries that host large-scale vaccine manufacturing facilities gained a strategic asset during the pandemic that reshaped how those governments think about pharmaceutical manufacturing as a matter of national security, not just public health. Several governments have since moved to fund domestic vaccine and biotech manufacturing capacity specifically so they're never again as dependent on a handful of foreign or even domestic private companies during the next emergency. That policy shift in itself is a form of power the pandemic created. Governments now treating pharmaceutical manufacturing capacity the same way they treat energy independence or food security. Here's the detail that reframes everything you've heard so far. The same handful of companies now sit on both sides of the table. They're the supplier the world depends on, and increasingly, they're also the ones being paid again to prepare for the next version of this exact emergency. And it's worth noting how quickly that same relationship can also unravel. In May 2025, the Department of Health and Human Services abruptly canceled $760 million of that same bird flu contract before the program was complete. A private coalition, CP, stepped in shortly after with just over $50 million to keep the program alive. The dependency didn't end when the pandemic did, but neither did the government's leverage to reverse course. Power built on a single relationship, it turns out, can be withdrawn as fast as it was granted. There's also a quieter, more structural form of power worth naming: lobbying influence. The pharmaceutical industry was already one of the largest lobbying forces in Washington before 2020. The financial windfall from the pandemic gave that lobbying apparatus significantly more resources to deploy at precisely the moment governments around the world were reconsidering how drug pricing, patent law, and pandemic preparedness should be regulated going forward. Every proposal to waive patent protections during future emergencies, every debate over drug price negotiation, every discussion of stockpiling manufacturing capacity domestically, all of it now takes place with an industry that has both more capital and more institutional credibility than it had 5 years earlier.
This is the actual transformation this documentary set out to trace. It didn't start as a story about power. It started as a story about risk. Public risk absorbed to protect private companies from the cost of failure. But once that risk paid off, the resulting profit didn't stay confined to a balance sheet. It became regulatory trust. It became manufacturing infrastructure treated as a strategic national asset. It became a seat at the table for the next contract, the next emergency, the next multi-hundred-million-dollar deal. That's how capital becomes power in this story, not through anything hidden or improper, through the entirely legal, entirely predictable compounding of advantage, public money removing risk, patents converting that risk-free position into exclusive profit, and profit converting into influence that outlasts the crisis that created it. If you've stayed with us this far, subscribe to Capital and Consequence and join us for more long-form documentaries about money, power, and the consequences behind the headlines. So where does this mechanism go from here? A few things are already becoming clear, and a few others remain genuinely uncertain, and it's worth being honest about which is which. What's confirmed is that the companies at the center of this story are no longer treating their pandemic windfall as a one-time event. Pfizer, Moderna, and BioNTech have all announced continued investment in expanding their mRNA platforms beyond COVID-19, targeting seasonal flu, respiratory syncytial virus, and in some cases, early-stage cancer treatments. The manufacturing infrastructure built during the emergency didn't get dismantled once demand slowed. It got repurposed. That's a structural fact, not a prediction. The factories, the regulatory relationships, and the government purchasing contracts are already in place for whatever comes next. What's less certain is how sustainable the pricing power that generated the original windfall actually is going forward. Available evidence suggests demand for COVID-19 boosters has leveled off considerably compared to the mass vaccination years, and companies are now competing for a smaller, more routine annual market, closer in size and structure to the seasonal flu vaccine business than to the emergency demand of 2021. Under this scenario, profit margins on COVID-specific products are likely to continue narrowing towards something closer to typical pharmaceutical industry norms, rather than the exceptional margins seen during the height of the pandemic. That doesn't mean the companies stop being profitable. It means the extraordinary windfall phase of this specific product line is very likely behind them. The bigger open question is what happens to the underlying mechanism itself. The model of public risk funding a product that then generates entirely private profit the next time a comparable emergency occurs. Some governments, particularly in the European Union, have proposed stronger conditions on future emergency funding, caps on eventual pricing, guaranteed technology transfer to lower-income countries, or public equity stakes in exchange for public investment. None of these proposals have been formally adopted as binding policy as of this recording. They remain proposals, actively debated, with the pharmaceutical industry lobbying against the more restrictive versions and public health advocates pushing for stronger ones. Which side prevails will likely depend heavily on whether another comparable emergency arrives before those debates are settled, and on which governments hold the most leverage when it does.
There's a second scenario worth naming because it cuts against the narrative of this documentary in an important way. It's possible that the enormous profits generated during the pandemic end up funding exactly the kind of future breakthroughs that public health advocates want to see. Faster development of vaccines for diseases that currently have none. Funded not by public grants, but by the private capital these companies now have in reserve, specifically because the pandemic proved the mRNA platform works at scale. Moderna, for instance, currently has an mRNA-based vaccine candidate for respiratory syncytial virus already in late-stage trials, a direct commercial product of the manufacturing and regulatory credibility built during the pandemic. and a concrete test case for whether pandemic-era profit actually translates into next-generation medical progress. If that happens, the story of who profited during the pandemic becomes harder to separate from the story of what that profit eventually built. Both things could end up being true at once: an unbalanced, patent-protected windfall during the emergency itself, and genuine long-term medical progress funded in part by that same windfall. Available evidence doesn't yet settle which framing will dominate in 10 years. That depends on choices these companies and their investors haven't fully made yet. What can be said with more confidence is this: the underlying financial structure that produced this outcome, public research funding, public risk elimination, private patent protection, and unregulated pricing once the emergency framing fades, has not fundamentally changed. No binding international agreement currently requires a different arrangement the next time a comparable crisis hits. Unless that changes, the most likely scenario is that this exact mechanism repeats, largely unmodified, the next time the world needs something only a handful of companies can supply fast enough to matter. And that's really the core tension this documentary has been building toward. Not whether these companies did anything against the rules, they didn't, but whether a financial structure built around public risk and private reward, with no requirement to share the upside proportionally to the risk that was absorbed, is actually the arrangement societies want to rely on the next time an emergency forces the same bet to be made again. That's not a question this documentary can answer for you, but it's the question the numbers leave behind. So let's go back to the question that opened this documentary. Who actually got rich from the COVID-19 vaccine? By now, the answer isn't complicated. A small group of companies, Pfizer, Moderna, BioNTech, and Sinovac, converted decades of publicly funded science, combined with billions of dollars in public risk elimination funding, into close to $90 billion of private profit in just 2 years. None of it required breaking a rule. It required occupying the exact right position, holding the patents, the manufacturing capacity, and the government relationships at the one moment in modern history when the entire planet needed the same product at the same time. But the full answer to that question was never just about who profited. It was also about who paid for that profit to be possible in 3 very different currencies. Taxpayers in wealthy nations paid in risk, absorbing the cost of failure so private companies wouldn't have to. Health systems everywhere paid in price, negotiating against sellers with no real competition. And lower-income countries, particularly across sub-Saharan Africa, paid in something no amount of money can fully replace: time. Nearly a full year separated the vaccination rates of wealthy nations from the rest of the world. And that gap wasn't an accident of geography. It was the direct, predictable outcome of a patent-protected monopoly meeting a limited global supply. What this story ultimately reveals is not a scandal in the traditional sense. Nobody broke the law. Nobody hid what they were doing. What it reveals is something more structural and in some ways more important: a financial mechanism built with good intentions during a genuine emergency that quietly determined who would be protected first and who would wait, based almost entirely on purchasing power, not need. That mechanism converted public risk into private reward, and private reward into lasting influence over how the next version of this exact situation gets handled. The uncomfortable truth sitting underneath the $90 billion is this: the world built an extraordinarily effective system for turning public science into private profit at record speed. It has not yet built an equally effective system for making sure that profit gets shared in proportion to the risk the public actually carried. Until that changes, the same mechanism is sitting ready, fully intact,
waiting for the next emergency that only a handful of companies will be positioned to solve.
Money didn't just fund a vaccine. It decided who received one first. And in a crisis, that decision was never just financial. It was quietly, and without anyone voting on it, a decision about whose lives got protected sooner and whose didn't. If you found this story valuable, take a moment to subscribe to Capital and Consequence, leave the video a like, and share it with someone who follows money, power, or global health policy. Drop a comment with your honest take. Was this an acceptable price for speed, or a system that needs to be rebuilt before the next emergency arrives? And let us know what financial story we should investigate next. For viewers who want the full research dossier behind this documentary, the Capital and Consequence dossier is available in the description. Until the next documentary, Capital and Consequence. Follow the money, understand the consequences.